The central nervous system contains billions of neurons organized into complicated networks called circuits, which are functional groups of neurons that process specific types of information. In a simple series circuit, a presynaptic neuron stimulates a postsynaptic neuron. Pretty simple, easy to understand. This is what we've been looking at. The second neuron then stimulates another, and on and on. However, most neuronal circuits are a little bit more complex. So when we're looking at neurons working together, one of the first types we'll consider will be diverging circuits. So this is an amplifying circuit where one nerve triggers a response in an increasing number of neurons. So here you can see the first neuron is going to cause an action potential that stimulates 2 neurons, and then from there 4 neurons. So the circuit diverges or creates more and more pathways. So this is very commonly found in sensory and motor systems. So a single impulse from the brain can activate hundreds of neurons, which then can cause thousands of muscle fibers to contract. The second circuit we'll look briefly at is converging, so the opposite of diverging. So to divert means to go from one to many. To convert is to converge is many funnel or pool into one. So here in this image you can see you have 3 neurons that are all stimulating one neuron, leading to an output. This is very common also in sensory and motor systems, and we see a lot of this in our special senses, such as the sense of smell and taste. Reverberating circuits are where you have a chain of neurons that feed back on themselves. So the stimulus the signal keeps going until the chain fails to fire an action potential. So it's driven by a positive feedback mechanism, such as we see in rhythmic activities such as breathing. So the stimulus comes from the first neuron in the chain to the second neuron in the chain to the third neuron in the chain, and then down to the 4th neuron. But wait, we've got another stimulus going on here that's sending that action potential back to this one and then back to this one. So you can see it is reverberating or going back on itself, leading to that continuous positive feedback rhythmic activity. And then parallel circuits, where we have incoming nerves stimulating several pathways arranged in a parallel array. So the signal reaches the cell at different times and continues to stimulate that postsynaptic or outgoing cell. So you can see you've got 1, 2, 3 parallel pathways of input coming into the cell for the output. So we use these types of pathways and circuits in a lot of the more complex mental processing, such as math and scientific reasoning. Your nervous system exhibits a characteristic known as plasticity, which is the capability to change based on the experiences of your life, what your nervous system is doing, what you're thinking, what you're processing. At the level of individual neurons, the changes can include sprouting new dendrites or making new proteins, or simply changing the synaptic contacts between the neurons and other cells, other neurons. So chemical and electrical signals drive these changes, but despite this plasticity, our neurons have very limited power to regenerate, to repair or replicate themselves. In the peripheral nervous system, damage to dendrites and myelinated axons may be repaired if the cell body remains intact and the Schwann cells that produce the myelin are still active. However, in the central nervous system, little or no repair of damage to the neurons occur. Even if the cell body remains intact, a severed axon usually cannot be repaired or regrown. In the central nervous system, neurogenesis, or the creation of new nerve cells, is almost completely absent. It's thought to be the result of inhibitory influences from the neuroglial cells, especially the oligodendrocytes, and the absence of growth-stimulating factors and cues that were present during fetal development. Axons in the central nervous system, remember the brain and spinal cord, are myelinated by oligodendrocytes rather than Schwann cells. And this central nervous system myelin is one of the factors that inhibits regeneration of neurons. Also, after axonal damage to the axons in the brain and the spinal cord, nearby astrocytes proliferate or make new astrocytes very, very rapidly, and when they do so, they form sort of a scar tissue that acts as a physical barrier to regeneration. So injury to the brain or spinal cord usually is a permanent damage. However, there is ongoing research that's hoping to improve the environment of these axons and help to bridge the injury gap so that there can be some regeneration of tissues. A lot of this research is looking at ways to stimulate dormant or inactive stem cells to help them to replace neurons, and also to develop and grow some of this tissue, some of these neurons in a laboratory setting that can be transplanted into the damaged area in hopes that repair will take place. In the peripheral nervous system, there is some repair possible, as we mentioned earlier, under two conditions: if the cell body is still intact and if the Schwann cells are still functional, and if the damage is not severe enough that the scar tissue does not form extremely rapidly. So the steps involved in the process of regeneration in the peripheral nervous system are chromatolysis, Wallerian degeneration, and the formation of a regeneration tube. So most nerves in the peripheral nervous system have axons that are covered with the neurolema. Remember, the neurolema was the membrane and most of the cytoplasm of that Schwann cell. So a person who injures axons of a nerve in the upper limb, for example, has a good chance of regaining some nerve function. So when there's damage to an axon, changes usually occur in the cell body of the affected neuron and the portion of the axon distal to the site of the injury. Changes may also occur in the portion of the axon proximal to the site of injury. Just depends on the cell and the severity of the injury. So about 24 to 48 hours after injury, a process of breakdown occurs called chromatolysis. So some of the organelles, especially the Niesel bodies within the cytoplasm of the cell, are broken down. About 3 to 5 days after injury, the part of the axon distal to the damaged area becomes swollen and breaks up into fragments. The myelin sheath degenerates, and even though the axon and the myelin sheath degenerate, the neurolema or the membrane still remains. So degeneration of this part of the axon and the myelin sheath is called Wallerian degeneration. Now, following all of this, signs of recovery may become evident. So macrophages can come in and start to clean up the debris. New RNA and proteins start to accumulate, which gives us new building material. The Schwann cells on both sides of the injured area start to multiply by mitosis and grow toward each other, and this can form a regeneration tube across that area. The regeneration tube then can guide the growth of a new axon from the proximal area of the injury to the distal area of the injury. However, new axons can't grow across the gap if the site of the injury is too large or if the gap becomes filled with fibrous collagen fibers, which create scar tissue. And we'll finish up with some clinical terms related to the nervous system. A neuroblastoma is a malignant tumor that consists of immature nerve cells called neuroblast. These occur most often in children and most often in peripheral nervous system. A neurologist, ology means study, so someone that studies the nervous system is a neurologist. There are many branches of neurology and many specialties associated with this. And then a neurotoxin, neuronervous and toxin poisonous. So this is something that is poisonous to the nervous system. So I wanted to do a little bit more on this and talk about some common neurotoxins such as some of those that are created by shellfish and other organisms. So neurotoxins are substances that produce their poisonous effects by acting on the nervous system. One very lethal neurotoxin is tetrodotoxin, or TTX, which is present in the gut of Japanese pufferfish. So tetrodotoxin blocks the action potentials by inserting itself into voltage-gated sodium channels so they can't open. So if the sodium channels can't open, of course, the cell, the postsynaptic cell, cannot depolarize, and that paralyzes that cell. Local anesthetics are drugs that block pain and other somatic sensations. For example, Novocaine and lidocaine, which can be used to produce anesthesia in the skin during, if you're having a cut sutured, or in the mouth if you're having dental work done, or even as a part of an epidural during childbirth. So just like the tetrodotoxin, these drugs act by blocking the opening of those sodium channels. So action potentials can't propagate, and when the action potentials can't propagate past that obstructed region where those receptors are blocked, then the pain signals can't reach the central nervous system. Rabies is a viral infection that can be fatal as it reaches the central nervous system through fast axonal transport. So it moves very quickly from the area where you were bitten by a dog or another meat-eating animal that may be carrying the rabies virus. So it moves very quickly from that site into the central nervous system. Some of the symptoms of rabies are excitement, aggressiveness, madness, and can be followed by paralysis and death. Shingles is also a viral infection of the sensory neurons in the skin. So shingles tends to develop in people that had chickenpox as a child, and the virus will basically lie dormant in the nervous system until the immune system is weakened, and then it may erupt and tends to be worse as you age. And then finally, we want to talk about a few other disorders very briefly. Multiple sclerosis is a disease that causes a progressive destruction of myelin sheaths in the neurons of the central nervous system. It affects about 350 people in the United States and over 2 million people worldwide. Usually appears in people between the ages of 20 and 40, and more often in females than males. MS is more common in whites, less common in African American, and very rare in those of Asian descent. MS is an autoimmune disorder where the body's own immune system destroys the myelin that forms the myelin sheaths. The condition's name describes its anatomical pathology. So in multiple regions, the myelin sheaths deteriorate to form very hard scar-like patches known as sclerosis, hardened scars or plaques. MRI studies show numerous plaques develop in the brain and the spinal cord. So the destruction of the myelin sheath slows and then completely short circuits the propagation of nerve impulses. Epilepsy is characterized by short and reoccurring attacks of motor, sensory, or psychological malfunction, although most of the time it never affects intelligence. The attacks, called seizures, happen in about 1% of the world's population. They're initiated by abnormal synchronous electrical charges from millions of neurons in the brain and are thought to result from abnormal reverberating circuits. Remember, this is where the stimulus feeds back on itself and causes additional stimulation and additional impulses. So the discharges stimulate many of the neurons to send nerve impulses over their conduction pathway. As a result, sometimes lights, noise, smells may be sensed when the eyes, ears, or nose haven't been stimulated. Skeletal muscles of a person having a seizure may contract involuntarily. Epilepsy has many causes, including brain damage at birth, which is the most common cause, metabolic disturbances such as hypoglycemia, hypocalcemia, uremia, hypoxia, infections, especially those associated with the nervous system, vascular disturbances such as hemorrhage or low blood pressure, head injuries, tumors, abscesses in the brain. Seizures have also been associated with fever, and that's one of the most common causes of these seizures in children under the age of 2. Excitotoxicity is a high level of the neurotransmitter glutamate in the central nervous system. So it leads to destruction of the neurons through prolonged activation of those excitatory postsynaptic receptors, so excitatory synaptic transmission. The most common cause of this is oxygen deprivation that happens in the brain due to ischemia or low blood flow. This happens during a stroke, so the lack of oxygen causes the glutamate transporters to not be able to work, so the glutamate accumulates in the space between the neurons and the neuroglial cells, and it basically just stimulates the neurons to death. There are some clinical trials underway with some anti-glutamate drugs that can be administered after stroke that are offering some protection from excitotoxicity and therefore protect those neurons from being destroyed. Depression is a disorder that affects over 18 million people each year in the United States. Those affected with depression feel sad and helpless, may have a lack of interest in activities that they once really enjoyed, and may even experience suicidal thoughts. There are several types of depression. However, most depression is thought to be a result, even though the cause is unknown, it's thought to be caused by an imbalance in certain neurotransmitters such as serotonin, norepinephrine, and dopamine in the brain. Factors that may contribute to depression include heredity, stress, chronic illness, certain personality traits such as low self-esteem or confidence, and hormonal changes. Medication is the most common treatment for depression, such as the SSRIs that we mentioned earlier. They do tend to provide some relief from some forms of depression by inhibiting the reuptake of serotonin. Serotonin, of course, is one of the neurotransmitters that's involved in mood. Some of the most effective SSRIs have been Prozac, Paxil, and Zoloft.